morning. This is my dear patient Michael, and he's going to talk to you today about his soft palate obturator. Mike, you and I met a long time ago, right?
Just about 20 years now.
20 years he's been a patient of mine. And he's going to take you on a little journey through his experience with his many different obturators that he's had over the course of his experience. But the gist of it is there are three: the one that goes in at surgery, the one after that, and then the final one. And over 20 years, I think he's had maybe 2 more final ones made because teeth change, fillings get changed, and then the obturator needs to be changed. So Mike's going to walk you through his experience with a soft palate obturator and what it does for your speech and your ability to re-enter society.
Okay, so about 20 years or so, I was diagnosed with adenoid cystic carcinoma. It was actually a tumor on the roof of my mouth, the palate, if you will. So I had gone to see the doctor, they checked it all out, and they said that I had to have the roof of my mouth removed. So before that, I came to see Dr. VeyVoda, and she was going to make up an obturator.
Which is, let me just back up for a second. For those of you who don't know what an obturator is, it's like a partial denture with clips on it. And if you're missing teeth, I can put the teeth on there. But what it does is it has like a plug that plugs into the hole in your palate that's left after surgery.
Exactly. So I had gone in to meet Dr. VeyVoda, and she took a mold in my mouth. This is all before pre-surgery. And I went in, she made the mold. I went and had the roof of my mouth extracted, taken out. And then just after the surgery, I went in to see Dr. VeyVoda, and she made the prosthesis for me, the obturator. And without it, I can't sit here and speak to you or have dinner or anything else or go to work. So I'm going to take it out so you can see the difference.
Show me what it looks like too.
Here it is. Clips on my teeth.
And listen to his voice now.
So now after I take it out, you can understand I have no projection of my voice. Any kind of things I drink or eat wants to come out through my nose. So obviously it's a hard time for me to live my everyday life. So it was made up, easy to click in, and now I can do my day.
Do his thing.
Yes.
Now the difference between Mike's obturator, which is a soft palate obturator, and a hard palate obturator is that a hard palate obturator, I'm able to make it so that it goes in right at the time of surgery, and you're eating and speaking immediately after surgery. But with a soft palate obturator, the soft palate moves. It's a dynamic, movable structure. So I have to let it heal for a week so that I can then go in and find the spot I need to touch to be able to allow Michael to breathe through his nose, but yet have good speech, powerful speech, and not have all this fluid and food coming out his nose. Now, why would fluid and food come out his nose? If you look in the mirror at your soft palate, there's no communication between your mouth and your nose because that curtain hangs down there. With Michael, that curtain is gone, so there's a communication between his mouth and his nose. It's as if I took one of the ceiling tiles out of the ceiling, you could see up into the 2nd floor from my office. And when he swallows, the tongue goes up against your palate and shoves everything up into the nose and out through the nostrils. Okay? Mike's going to take his obturator out again, and we're going to zoom in and let you see his defect. Is that okay?
Sure.
If you can see, when you're looking at this video, on your right, there is soft tissue. On the left, there isn't. There's like a reverse U-shaped cutaway in his palate, in his soft palate. Say ah, Mike.
Ah.
See the right side moving, his left side, your right side. Say ah.
Ah.
Right. So what the obturator does, say ah again. What the obturator does is it closes that defect, which allows him to swallow and speak without any nasal speech. Put it in, Mike. Now put your head back. See how the silver part is on his hard palate, and do you want to hand me my mirror, please? And the plastic part that closes up the hole is right here. Say Mike. So the remaining soft palate, elevates and moves to seal against his prosthesis. Okay, Mike, you can sit up. So you've been living 20 years with this.
20 years.
Now also, Mike, you've had radiation, right?
Yeah, 37 treatments of radiation.
37 treatments of radiation. Now, what is my mantra that you hear every night before you go to bed?
15 minutes of a fluoride treatment every night before bed, save the teeth.
Saves the teeth. Michael is 20 years down the road and he still has all his teeth. If he did not use that fluoride, I could promise you he would have no teeth. And unfortunately, the flip side of having no teeth, having your teeth dissolved, is that you can't extract them from a radiated bone without possibly causing a dead bone situation, which then they have to remove. So he would be missing part of his jaw because of teeth that dissolved after radiation. You can prevent all of that with the Neutral Fluoride. Okay, Mike, thanks.
You got it.